Sue Weldon here with our Ask the Expert series for February. And this one's a special one that we're doing live because it is backed by popular demand. I think you've all heard the catchy title that we had, Potty Talk. Might be a catchy title, but boy, it is a serious issue with a lot of our members. And we know that, there's a lot of conversation about diarrhea and constipation and GI issues and things that occur when you're on certain chemotherapies or types of therapies for your cancer treatment. So we wanted to come back and address it again because the conversation just kept going. And I think we had a 90-minute speaker series the last time in November. So today I thought we would bring on both of our experts, and they are all internal in-house with Unite for Her. But before we start with that, I just want to thank our sponsors. Our digital series and our education program, we can't do it without our friends at West, who is our presenting sponsor, as well as Daiichi-Sankyo, Lilly, and Merck. We thank them for being a part of the education series that Unite for Her has been able to put on each and every month. We also wanted to let you know that we are streaming live on Facebook, as you can see, so you can get into the chat, right, and ask us questions, and we'll be following along and making sure that your voice is heard. We got a lot of members that gave us questions ahead of time. I have them here listed, ready to go, so we're going to end up doing that as well. And then I also wanted to say that, March is ahead of us and we have a really exciting lineup. So just try and save some dates for us. We have Wednesday, March the 8th at 5 p.m. Eastern Time. We're going to be featuring acupuncture and talking to you about an actual appointment coming right, streaming in. Erin is actually going to be on the table. I am going to be your host, and we're going to take you through what an acupuncture session looks like. For me, as many of you know me and have heard my story, acupuncture was key to my healing. One of the reasons why I wanted to create Unite for Her. On Thursday, March the 9th at 6 p.m. Eastern Time, we're going to be joined by Dr. Lexi Munch, and she is a behavioral sleep medicine therapist heading that program at the University of Pennsylvania. She'll be talking to us about why so many people have problems with sleep and trying to understand how to get good quality sleep. And we'll have tips for us as well. Another topic that the community has definitely brought our way and we want to address. Please know that all of our Ask the Experts, our speaker series, our virtual hangouts, they all live on the uniteforher.org/her library. That is a place where you can go in anytime. You can get access to it, rewatch it, share it with people that you love, and just get all the information that we're putting out there, even if it's not something that you can work into your routine and join us live. All right, so let's see how we're doing. We got some people joining us. Hi, everybody. Thank you for joining. I am going to bring our first guest in, and she is no stranger to any of you because she is so busy in our Unite for Her community, treating our members with nutrition. Erin Pellegrin has been with Unite for Her for over 8 years. Hi, Erin. How are you?
Good.
She's the director of our culinary nutrition program, registered dietitian. You all know Erin. She leads a staff of 3, her making 4, and always here to host these events as well. And bringing her back as an expert on this has just been such an important issue for us. And I'm glad you're able to join us. And I'm glad I can be your host today. We're sort of switching roles a little bit. Yeah. All right, Erin. So I'm going to get right into it because I think we had so many questions coming right from the community that I wanted to start with those first.
Great.
So the first one is, what is the best way to manage constipation due to a medication we are taking?
Oh, great question. So, we'll start with constipation in particular. So it really is a multifaceted approach because number one, you want to figure out what's the medication that's causing it, because that is really indicative of how are we going to approach it. So if it's something that like an opioid, like a pain medication that a person is on appropriately prescribed by a physician, they are notorious for being constipation causing. So in that instance, nutrition, food alone is often not enough because of the impact that it has on our GI health. So in some instances, it's always worth a conversation with your physician if there's additional sort of medicinal support that you may need, but that's worth a conversation with your medical team. Outside of that, from a nutritional and a food perspective, one of the first things that I like to call out is that in addressing constipation, it has to be something that we do consistently. And from a food perspective, what we're looking at is fiber first. So we want to start thinking about trying to establish a good bowel regimen. And we need that by adding fiber to our diet. So fiber comes from our plant foods solely. So we want to start thinking of incorporating a variety of plant foods. So that includes, of course, our fruits and vegetables, but we're also looking at things like our beans, our lentils, different nuts and seeds, whole grains. And if some of these foods are new to you, you want to start to bring them into your day-to-day slowly and in small amounts, especially things that are known to be a little bit more gas producing, things like our beans, our lentils, even some of our vegetables, because we want to give our body time to adjust. So you want to think about making fiber foods more of your day-to-day routine, because again, we want to establish a good bowel regimen, and that means consistency. So we want to start to slowly bring those foods in regularly. Hydration is a big part of also managing constipation, because fiber can't work if it doesn't have adequate water in our system to help things move along. So you want to make sure that you are drinking water as your beverage of choice during most days of the week. Of course, other beverages, warm beverages can be really soothing if you're having constipation. So some people love to have a little bit of warm water with lemon and some ginger. Sometimes some warm tea feels really soothing to the belly. So that can be of assistance as well. Also know that movement in general is really good for constipation. So getting up and walking, doing some gentle stretching, doing some gentle Pilates or yoga moves can help with moving some of that GI tract as well. So you want to make sure that you're getting up and moving. And then I do like to say, sometimes we want to rely on some of those old tried and true things that we often lean into, things like prunes, which can be really helpful for constipation, or even a little bit of warm prune juice. When I worked in the hospital setting, our oncology nurses sweared by just warming a little bit of warm prune juice to help with constipation. So these little things that we can do to establish some good GI habits can be supportive of it. But it's worth noting not everything works for everyone, and it can take some time. If a person finds that you are not going to the bathroom for 3 days in a row, that is absolutely worth a call to your physician, your medical team, because you may need something a little bit stronger to help get things moving.
Yeah, it's great, Erin. I'm so glad you brought up the water, because sometimes people don't realize that, it needs a little help to move along the fiber. So
Correct.
it's really key. There were some great tips you pulled out in there, movement of your body, using the water. We actually have Mandy in the audience, and she asked if does a sparkling water work just the same way as a water, or as a beverage of choice like LaCroix?
Yeah. So we used to think that sparkling carbonated water wasn't as hydrating, but we have known that that just is not the case. So if you prefer sparkling water, it can be just as hydrating. Sometimes even just throwing in a sparkling water, because we know sometimes water gets boring, just allows us to change it up a little bit, gives us a little bit of flavor sometimes. So it gets us more ounces. So if you like that, go for it. And Janice, I love what you mentioned, that kiwi can be good as well to help keep that can support bowel movements as well. And a lot of that has to do with the type of fiber that's in kiwi. So absolutely, that can be good as part of your bowel regimen.
Awesome. I hope everybody's taking some notes. So some really good tips, and that's just the first question, Erin. All right, we're going to go on to the next one. So one of our members is taking Ibrance and letrozole for metastatic breast cancer, and it does not happen all the time, but she certainly has days where she has like this urgent loose bowel movement, sometimes multiple. Is there anything that she can avoid in her diet that would prevent this from happening? She likes to travel, and she worries about it, and not getting to the restroom in time, and it's a true worry.
Right, right. And I think the hardest and most frustrating part of this is, the lack of being able to anticipate when this is going to happen, right? So we know that that can be really frustrating. So there's a two-way approach that I like to do in this sort of situation. So number one, what you want to try to do is first try to identify your triggers. This is where food journaling can come into play, right? So if you just sort of keep track of when you feel like you're starting to have some of those GI upsets, and you're tracking two things. So number one, you're tracking your food, your beverage intake to see if you can identify if there is any link between when you're having some urgency, some loose stool, and what type of foods or beverages you're having. In addition, you're also tracking your emotions because, as you'll learn once Sarah hops on, our gut and our brain has a very close relationship with one another. So you might also start to identify, oh, I'm having these instances when I'm feeling really anxious, when I'm having a really stressful day. And what this allows us to do is put the puzzle pieces together. So number one, just sort of building that connection is really helpful. Number two, be mindful that there are some general sort of textbook foods that we know can be a little bit of an aggravator when we're having some loose stool, some diarrhea. So things that we tend to call out, number one tends to be dairy. So even if from day to day you tend to tolerate cow's milk products just fine, when you're having a little bit of GI upset and irritation, sometimes an individual can be a little bit more sensitive to lactose in particular. So that may be something you want to hold off for the time being until you sort of get back to baseline. Sometimes your raw fruits and vegetables, because of the type of roughage, the type of fiber, that also can be a little bit irritating. Doesn't mean that you can't consume them, but maybe we're shifting how they're prepared. Maybe we're cooking them, we're throwing them in a smoothie, we're sort of breaking them down, we're softening the fiber a little bit, which allows it to be a little bit more easily digestible in our GI tract. And then again, you can start to bring back in those raw fruits and vegetables when you are feeling a little bit better. Other foods, things that are a little higher in fiber, like our beans and our lentils, again, sometimes can be a little aggravating if we're having some diarrhea. So you might want to be mindful of that. Maybe we're sticking to some more bland, lower fiber foods for the time being. Also knowing that both caffeine and alcohol can be stimulants to the GI tract. So you might want to be mindful of especially your caffeine intake, that if you do like a little bit of coffee, maybe you're being mindful of how much caffeine you're having, or maybe it's a day that you have an herbal or a non-caffeinated tea instead. The other thing worth noting with diarrhea is that that there is quite a bit of hydration loss when, especially with consistent diarrhea or loose stools, we tend to lose a lot of water and we can inadvertently become dehydrated. So you want to make sure that you're also staying hydrated when you're experiencing those as well.
Yeah, thank you, Erin. On the fiber, question, there was one of our members that says that, the doctors always tell her to eat more fiber. When she does, it backs her up. And I heard you talk about that healthy balance. Can you just key in on that one more time?
Yeah, and I'm glad that question came up because I think that's a question and an experience that a lot of us have, which makes us feel like I can't tolerate fiber. My body can't break down fiber. And
Yeah.
it's really the approach that we are taking. So yes, we absolutely want everyone to increase our fiber intake a little bit, but it has to be gradual. So sometimes we feel like diving into a big bowl of black bean soup or something. And I would say if that is something that's not part of your norm, pull back. So, because what happens is we want to gradually allow our GI tract, our healthy bacteria, to get used to to be introduced to that type of fiber in the food. So, small portions, consistently and gradually, you increase the quantity of fiber. And remember, you want to drink water as you are consuming those foods. And with time, as your healthy bacteria adjust to that fiber, those symptoms, side effects, that bloating, that distension will subside. I usually say give it 10 days to 2 weeks of consistent intake to allow your body to adjust. And slowly, slowly, you can increase that fiber intake. But you definitely don't want to jump in head first to like a big bowl. As much as, we appreciate the enthusiasm, just give your belly time to adjust. But it by no means is an indicator that we can't break it down or we're intolerant to fiber.
Okay. Slow and consistent.
Yep, absolutely. And lots of water.
Great. Okay. So in addition to a lot of common GI issues, Erin, Many of the cancer medications, they increase nausea and, diarrhea. Can we do in terms of food choices to help? And you touched a little bit on it, but do you have certain foods like you just know tried and true that you could answer this member's question on?
So let's start with nausea because this is a really big problem. So nausea's interesting because again, every person sort of reacts to their nausea differently. So a couple tactics that we often share. Number one is understanding when we're nauseous, we are very sensitive to the smell of food. So you want to be mindful of maybe we're going to hold off on having foods that tend to be more pungent, more strong smelling, have strong spices to them, just because for anyone that's been nauseous, all you need to get is one whiff of something and it upsets your belly. So you want to be mindful of the smell of food. With that, you may also want to be mindful of the temperature of your food because hot food tends to be more aromatic. So you might want to either, one, let your food cool down a little bit, or two, just reach for food that is room temperature or cold because there can be less of a smell. And again, really being mindful of just food that tends to be pungent in general. So tuna fish might not be my first go-to because it tends to just be more pungent. In addition to that, with nausea in particular, you may find that having a big meal, having solid food is not so comfortable in the belly, but you might do better with liquids. So you might lean on things like smoothies. You might lean on things like broths or a soup, a broth-based soup that is room temperature, but you can sort of sip on. Be mindful of portions because a big, heavy meal is often something that will not feel good in the belly, but you might do better with smaller portions. It's okay to have just 2 or 3 bites or spoonfuls at a time and come back periodically. So please don't feel like you need to sit down at the table and have a formal meal with your family because that just not may be good for you there.
Yeah.
Moving over to diarrhea, again, we sort of touched on this, but you want to be mindful, maybe you do better. I think portions is something to really call out. You might do better just having smaller portions of food more frequently throughout the day without inundating with these large, heavy meals. Just take it little by little.
Great. Thank you, Erin.
Yeah.
Okay, there's a couple questions about diverticulitis. And at some point over the past few years, most likely post-cancer treatment, she said that she had several, about 5 or 6 flare-ups.
Yeah.
Uncomplicated, treated at home. She knows that stress and diet can contribute to these flare-ups, but are there any known connections between cancer chemotherapy, radiation treatments, and diverticulitis flare-ups?
Great question. So, potentially. So I haven't seen any science regarding the relationship between the two, but what we look at is how bowel habits are affected. So let's back up a little bit and I will quickly go through first starting what is diverticulosis. So diverticulosis is the presence of pockets in our colon, which some research points at a diet that's traditionally like a Western diet. Low fiber can be a reason why we are starting to see more instances of the presence of these pockets. Now, it's often seen, unless a person has a flare, they're only really seen on a colonoscopy. And they're not really a problem unless a person has a flare, in which case the instance of having a flare or an episode of irritation is called diverticulitis.
Gotcha.
So what happens is these pockets get inflamed and infected, and they have to be treated with an antibiotic. Now, the most important thing from a regularity standpoint is incorporating fiber into your day because that helps having regular bowel movements, which can help reduce risk of developing a flare. So when we go back to treatments, medications, are they causing constipation, in which case is not allowing us to have regular bowel habits and a bowel regimen, which could increase risk for diverticulitis. You see that relationship there?
Totally. Yep.
So that's where I think that relationship lies. So here's what I would do. Do your best to, again, maintain a good bowel regimen. When I say bowel regimen, it really incorporates a lot of things. It means, foods and fiber and water and consistency, But so much of our bowel regimen is also about getting on a regular schedule, right? It's why traditionally we think of, we get up in the morning, we have coffee, we go to the bathroom, because our body runs on a clock. So that's also part of that bowel regimen as well. So you want to just do your best to try to maintain a good bowel habits, regularity in going. It is okay. And we want to, outside of having a flare, we want you to have fiber, because that helps keep things regular. During a flare, that's something that we pull away from until you're healed and the inflammation has subsided. And then we slowly reintroduce those foods a little bit. But directly between medications and diverticulitis, I don't know that they're directly related one-on-one, but certainly, one is longitudinally connected to the other.
Gotcha.
Yeah.
All right, we have one member that is talking about Ibrance, and she noticed that the drug is causing heartburn and acid reflux. What can she do to decrease that side effect?
Oh, this is a great question. And I will tell you, so many medications that our members are on come back to us and say, I never had reflux, and all of a sudden I do. And a lot of these medications are driven. So number one, I will say, sometimes, again, you may require a medication for a period of time to help bring down reflux. I always say, if you're started on something like a pantoprazole, lansoprazole, some sort of PPI or H2 blocker, it should not be something that you are on forever. You may need it during treatment, or at least initially to get things under control, as with Ibrance, because we're on it for a long period of time. But the goal should always be to wean off of it. From a nutrition perspective, reflux is hard, because what do we know? There are common foods that can be aggravators of reflux, right? So we think spicy foods, acidic foods, alcohol, caffeine can be aggravators of reflux. Even not eating and having an empty belly for a period of time can sometimes cause the acid from our stomach to build up, giving us that reflux. Over consuming a lot of mint or peppermint, as that may soothe nausea, what happens is it can over relax the sphincter between our stomach and our esophagus. And when that sphincter relaxes, the acid can sometimes come up into our esophagus. So there's a lot of things that we traditionally know may be culprits for causing or aggravating reflux. But again, it's a very individual condition. And so that's also where a little bit of food journaling can come into play. Did I have something a few hours later? I have reflux. You want to be mindful of timing of your eating. So if you know that, you have a little bit of indigestion, be sure that especially late at night, you're not eating and then laying down. You want to give yourself time, 45 minutes to an hour, ideally, to sit upright so that digestion, gravity can happen, and things can start to move out of the stomach through the digestive tract. So, I share these textbook foods, but I've talked to so many of our members that, like, I do fine with all of this, but carbonated beverages really react with me. Okay, then it's good that you've identified what's your trigger food, and then be mindful of consuming them. And maybe you want to avoid those for the time being until your reflux is under control. It's really, it's so individualized.
Yeah. All right, I'm going to do one more, and then I'm going to bring on Sarah.
Yeah.
So what can you do post-treatment to heal your bowels? Symptoms are stomach pain, irregular bowel movements, which are thin and mucousy. CT and x-rays are clear. She's taking Good Belly and aloe juice. I don't know, maybe tell us what Good Belly is, Erin. I've never heard of that.
Yep. Good Belly is just a line of foods that have probiotics, that have live active cultures in it.
Okay.
Yep. So I think that could be a good introduction to help establish, especially coming off of any sort of medication, because, strong medications like we're on with a cancer diagnosis can really affect our microbiome. So establishing good, healthy bacteria with naturally fermented foods, I think, is a great place to start. It's worth noting that aloe in large quantities can cause diarrhea. So if you're having sort of thin stools, that might be something that I would pull away from in an effort to see if you feel any sort of relief. And then coming off of a treatment, again, what we want to try to do is establish and start to reintroduce good bowel regimen, which I will say takes time. So that means slowly start to introduce fiber foods. Likely you want to start with maybe cooked fibrous food. So not jumping into like a big bowl of salad, but maybe we're sauteing, we're roasting in a soup or a stew. The softening that fiber makes it more easily digestible. We're slowly starting to bring those foods back in. We're giving our body time to adjust. Remember, consistency is key. And little by little, as things continue to regulate, you can start to bring in new foods and introduce new foods. It does take time. There will be ups and downs through all of it. That is all normal. And so you might feel great for a week, and then all of a sudden you have a terrible day and you're like, I can't get out of the bathroom. It's probably not because of anything you did wrong. It's just the normal ups and downs as your body heals. The next day, see how you feel and start all over again. If you need to take a step back, that's okay, but we want to slowly move forward and try to establish a good bowel regimen.
Great. All right, Erin, will you stay with us a little bit? We're going to
Yeah.
move into the emotional
Oh, so good.
this topic because we know how valuable it is.
Mm-hmm.
So I'm going to bring on Sarah. For many of you, you know Sarah Murphy. She's on staff with us, but she's actually been with us since 2013, right, Sarah? Helping and treating our members and just so valuable. So Sarah, I love that you were able to address the emotional side of these types of GI issues. We know it's a big issue. It was so popular when you spoke before. So I'm going to dive right in if that's okay.
Absolutely.
All right. So the one question was let's just set the stage. How does one's digestion affects one's mood?
Oh my gosh, it's such an important thing. And something when I was in grad school, we didn't even talk about, but our gut is where most of our neurochemicals are created. For example, we've probably by now all heard about serotonin, which is highly implicated in depression. Our serotonin is created in our gut. So when our gut is out of balance, it can create imbalances in our neurochemistry and cause our mood to go out of whack. Just like top down, if we're feeling very anxious, it can throw our gut out of whack. Bottom up, if our gut's out of whack, it can throw our mood off. So
yeah. I know we all have that nervous stomach. Like there's a reason why we have these phrases, that our grandmamas coined, but
yeah.
It is true, right? How would you say then, what mind body tools can help improve one's digestion?
So taking into consideration the fact that it's a two-way street, and it's really important to think about all the physical and dietary changes that we make to try to bring our gut back in balance, but also top down or emotion in is really important. So for example, whenever we're anxious, our brain waves are spiking these high beta wave brainwave frequencies. We need to slow our brains down to get them back into a calm state. Then we won't feel anxious anymore. It all goes together. Anything that we do that slows down our physiology will help slow down our brain waves and get us out of that anxiety, fight, flight response. So that's why, speaking of our grandmother's advice, count to 10 before you say anything. I always found that really difficult. It was more important to count to 10 regularly or slow down the breathing regularly and not try to put a cork in it when you're ready to explode. But all the things that we can do, slow, steady breathing, slow rhythmic movements, things like yoga, Tai Chi, Qigong, meditation practices. One of the things that we use a lot, for those of you who are on the Facebook, you might recognize my face because I'm doing the weekly meditations on Wednesday afternoons. And I always incorporate this heart breathing. It's an evidence-based technique created by researchers at the HeartMath Institute. And I heard them say they tried different recipes and they found that this was the most effective tool to get us out of the fight-flight response and into a relaxed state of being. It's so simple. You imagine that you're breathing from your heart, not your diaphragm. And part of the thinking for that is that the vagus nerve regulates that autonomic nervous system that's either a fight-flight response or relaxation response. And the fight-flight is below the diaphragm and the relaxation is above the diaphragm. So we're focusing on the heart center as if our heart itself is breathing. We slow down our breathing rate. So it's about 5 seconds in and 5 seconds out. And once we have that rhythm going, we're then deliberately accessing positive feelings. purposefully accessing gratitude, compassion, appreciation, love, awe, by thinking of someone or something that inspires those feelings, or recalling a time when we were feeling really good and doing really well. So that within 3 to 5 minutes will get us out of that anxiety and into a calm, relaxed state. And then, yeah, rebalance that. When our gut's out of whack, we can use our mind to help, or we need maybe extra help from the mental side and emotional side, because we're automatically being thrown off balance a little bit more physiologically. And then also calming down will help our bodies to relax and our digestive system to flow more freely.
Yeah, I just did it while you were talking about it, and I already feel that, when I was diagnosed, and I'm going on 19 years now, I remember yoga helped me with my nausea. And for me, I just couldn't get over that, and it was the breath. It was me understanding how to do the breath and not putting those two together. I just knew the practice helped me with nausea and not putting it together. But, you make it very clear on this breathing and breathing from the heart. I've never heard of that, Sarah. So
That's so interesting, isn't it?
yeah, I love that tip.
Mhm.
How about, how can I feel good about my daily life when I have all these potty issues, right? Like, how do I
Right.
feel good about that, to walk out the door, to get dressed in the morning and think about what we put on, and
Oh my
it's
gosh.
exhausting, right?
So yeah, it's so challenging, and it's really important for us to cultivate, I think, that kind of meta construct, this is what's happening right here, right now, and bringing that kind of mindful quality to how we're moving through our day, and being patient with ourselves. Just, trying to stay in the moment, trying to find the little things that we can be grateful for anyway, doing the things that we know can boost our mood and bring us more of a sense of peace, even when so many things are falling apart, or feels like so many things are being taken away from us. And it's really important to not try to bottle up our feelings or not feel like a failure if we're having uncomfortable feelings. There's no such thing as an incorrect feeling, but there are thoughts that can generate more and more uncomfortable feelings, right? So we want to try to come back into balance with a little bit more of a mindful or detached or metacognitive awareness of what's happening, just trying to stay in the big picture and then trying to stay in the moment. So I think that, being patient with yourself is really important.
Yeah. Thank you for saying that. And I also do feel that it is a little bit of work, right, Sarah? Like, I heard Erin talk about consistency, and just take your time. And so I love the patience, I love the consistency, but also approach it like homework, right? A little bit of homework for yourself, to remember the things that you can control,
Yeah.
work on the things that you can't, right?
Yes,
A little bit of
exactly.
homework.
That's the most important thing, that I always use this metaphor of having our hands on the wheel, and recognizing the locus of control, like what we do have control over, and the limits of control. So many things are outside of our control, especially when you're dealing with a cancer diagnosis and treatment.
Yeah.
But then instead of thinking about all that, well, what can I do? I can do my mind body practices. I can stay disciplined with my dietary changes. I can remember to be patient with myself.
Yeah. Do my heart breathing that you just taught us, right? What can I do? Oh, it's so good, Sarah. Okay, there's one of our members that said, we know relaxation helps. She just can't relax. She just can't do it.
Yeah.
What can I do?
Yeah. Yeah. I get it. It's especially when everything is the stakes are high, right? So it's really hard to relax. And it's like a double whammy, because we know that relaxing is important for us and will help us feel better. So it's really kind of a trap. And that's why being patient is really important. But involving the body is so helpful. We're learning more and more. There's a great book out, probably, I don't know, 5 or 10 years now, called The Body Keeps the Score by Bessel van der Kolk. Toward the end, it really gets a little dry, but it's got a great example, filled with great examples that show how much involving the body in our mental, emotional health is really, really important. So, and there's also a saying from the East that the wise person knows, they say man, but the wise person knows when to meditate and when not. because if we're really in a bad state of mind, sitting to try to do meditation is probably, it could be counterproductive. So don't push it if it feels like it's not working for you. That's when you want to try the yoga, the Tai Chi, the Qigong, the slow breathing. There's in addition to our heart breathing that we just talked about, Andrew Weil is famous for his 4-7-8 breathing. And you can do a simple Google. It's an inhale for a count of 4, hold it for 7, exhale for 8, inhale for 4, hold it for 7, exhale for 8. And he's stipulating you do that regularly. And within a couple of months, then it'll be like your body will go into that calm state just as soon as you start doing it, because you're practicing. So it's another discipline yourself, practice. You're playing the long game. It's not like right now, all of a sudden, boom, we're going to be sitting high in the Himalayas doing our meditation and levitating. It's going to be slow and steady wins the race, but really try involving your body. And one of the things that I'm really passionate about is the tapping tools, this EFT tapping and other related things, where we're doing this rhythmic, and maybe it has something to do with acupressure. That's the theory, but who knows? We know for sure that it works, so that we tap this series of acupressure points, and it, whether it's acupressure or the slow, steady rhythmic movement, whatever it is, people titrate down, not titrate, their distress decreases. So it's a becoming like gangbusters in the self-help world, but it's also a really valuable clinical tool. And there's really something to it.
Oh, it's great, Sarah. Sarah, you did that in November. We did a little bit of tapping during that session. So for our community, just know that you can go back to that November series. It was a speaker series, and we'll put it in the chat as well. But know that you can go back there and actually go through with Sarah some of the tapping, I guess just a routine, right? A little routine. No more than 5 minutes, I'm thinking, right, Sarah?
Yeah, it's so quick.
It's so
Absolutely.
quick. Yeah. Okay. We had a question from one of our members, and she wanted to know that how do you know if it's stress or an actual virus that's upsetting your stomach?
That's a good question.
No, it's a good question, right?
Really good question. And I don't have the answer for
I
that.
know. I guess it would hang around a little bit, it would be a little bit different. It would hang around and not come and go, right?
Yeah. And I mean, when you have a serious health thing happening, you want to talk to your healthcare provider. The stress causing the discomfort and the digestive stuff. If you have something that's acute that comes on, you want to seek treatment, and you're under medical care, like take it seriously. But if you know that you're anxious and then you feel yourself starting to get sick or nauseous or need to go to the bathroom more, then that's where starting to incorporate some of these mind-body tools for self-soothing becomes really, really important.
Yeah. And maybe always check it out with your physician, because sometimes we mask some of these symptoms and you truly do have some type of virus or some type of illness, but you keep being told or thinking it's stress or anxiety. So I think if anything goes on too long, right, Sarah, get to your physician. Don't second guess yourself. You know your body better than anybody.
Don't second guess yourself. It's always, but the risk of like, I was the little boy that cried wolf versus the risk of there was something seriously wrong that I didn't take care of. I'd rather risk the little boy that cried wolf and I'll take it, right?
Totally. Okay. There's one that came from our members as well. And she said, how do I cope with anxiety when going through radiation every day for 6 weeks? And you've already given a couple tools. I can just visualize her doing this during her radiation, but I'll let you start there, Sarah.
Yeah, I would love to, before you start the 6 weeks of radiation, spend some quiet time with yourself, imagining that you're going to be going into this. Know that the time getting there and the time getting your clothes off and getting your clothes back on again, going home, is way longer than the time of getting radiation. And the whole thing is just a disruption into your routine, except for then it becomes part of your routine. So people who have gone through it say that it's just maybe tiring, but other than that, it's really not that horrible. Okay. So just have that in the back of your mind, and I'm not going to tell you how to feel about it, but tell yourself, imagine take a minute to just quiet yourself down, go into your heart, do some of that heart breathing, or do something that just opens up feelings of love and gratitude. And then just picture yourself calmly going through. Everybody's happy to see you. You easily go through the radiation. You're getting yourself dressed again and going home feeling proud of yourself, and counting down the days until it's done, and just picture yourself moving through it with calmness. And when you practice that, pairing the relaxed state with the imagining the thing that's happening, it'll change how you feel about it for sure. Also, doing the EFT tapping if you're really anxious about it is something that could be really helpful.
Yeah. Okay. I know too, one of our advisors, there was a study that was shown, the effects of movement before and after radiation can help so much with exhaustion. So if you're walking before you do your radiation, then you walk again after. If you do a little movement and yoga before your radiation, I'm only talking 10 to 20 minutes, and then you do a little bit after, it has been shown to reduce the amount of exhaustion that one feels, because radiation can exhaust you. It is cumulative. And then all of that, we heard Erin talk about movement for constipation and for some of these side effects with the GI tract. So it really is this beautiful marriage, right, of what you're talking about, what Erin is showing us, and that movement all together. So really great study, which I was happy to see go into the Journal of Medicine, that you can do that as well. All right, I am going to bring Erin back up, and I'm going to do let's see if we can have some final remarks. Anything that I missed from either one of you? We've been watching the chat. Here's one. It's from Angela. This is one. She said, child stays in the bathroom for hours for constipation or urgency to go. What can you do to take them away from the state of mind that can leave the toilet? Child stays in the bathroom for hours of constipation or urgency to go. What can you do to take them away from the state of mind that you can leave the toilet, so that he's ready or she's ready?
Right. I think that this is something in general, when we have any kind of problem like that, it's better, not just bathroom related, but any kind of problem that's a pattern, address it when it's not active. So find a time when the kid's not in the bathroom to talk about what's happening for you when you're in there. Are you really happy with how that's working? What could we do instead? How about if you try, and just kind of talk it through when they're not anxiously on the toilet. So that's one thing. And maybe, have a chat with a doctor or a clinician, another kind of mental health clinician, to see what maybe is underlying that. But I would, first order of business, try talking it through when the problem is not active.
Yeah. Thank you, Sarah. That's good. Okay. We have a question from Robin. So she said, is there any, and this is for Erin, is there any direction on gut health in general for pro or prebiotic?
Love that. Yeah, absolutely. So we'll talk prebiotic first. So prebiotics are really important, and they are found naturally in our food. So prebiotic is the fiber, the nutrients that actually feed our healthy bacteria. So think the food that we are feeding ourselves to thrive, our microbes actually have to feed and ferment in order to thrive as well. So you want to incorporate absolutely foods that are naturally prebiotic containing. That includes things like artichokes, potatoes, lentils, garlic, onions. So again, many of our plant foods naturally also contain prebiotics. So I think just continuing to incorporate plant foods and a variety of them is a great way to naturally incorporate the food for our healthy gut, which creates healthy bacteria and a variety of bacteria, which is also important. Probiotics, that conversation is a little bit more difficult because there is not a lot of research behind probiotic, in particular, different bacterial strains. There is some research out there, and it definitely is promising, but more needs to be done. The other complicated part of this is each person's body is different, right? So my microbiome is different from Sue's, is different from Sarah's. So while we understand that certain strains of bacteria may be helpful in certain ways, and a lot of that research has to do with different bacteria and the relationship with our mental health, not all work for everybody. So I don't necessarily think it's the worst thing if you're coming off of a strong medication regimen, especially a course of antibiotics, to take a probiotic for a period of time to help like reestablish good, healthy gut balance. Now, what that concoction looks like and the strains that look like is hard to tell. So here's what I normally say. If you want to start a probiotic regimen for a period of time, you do not have to start out with like some crazy high mega dosing. Start with an adult formula from a trusted company that has third-party testing. And you want to do either an adult female or an adult male, because the strains will differ based on, women have particular strains that are through our vaginal tract and urinary tract compared to men. So start there. See how you feel. If you have really adverse side effects when you start, that is an indication that maybe this formulation isn't right for you. So you could potentially try that and switch. But also remember that we can also lean into naturally fermented foods, which naturally contain healthy bacteria, which is always a great place to start. So yogurt with live active cultures, fermented vegetables, kimchi, miso that has live active cultures is something that's safe and something that we can all incorporate in little bits day by day.
Terrific.
Yeah.
We have another question here from Sarah. She said, does the lack of estrogen impact the gut? And then I guess what about depression as well, impacting the gut?
I'll speak a little bit to the first part of the question, just about hormones and gut. So yes, we absolutely know that estrogen impacts our gut and especially can cause some shifts in our bowel regimen in particular. We don't quite understand why that happens, but we do know, which is why we often see anytime a woman moves into menopause, whether it's naturally or as the result of medication, there tends to be a change in bowel habits. So we do know that the two are related. So with that being said, again, if you're starting to see a shift, let's do a little bit of investigation in terms of how can we, again, work to establish a good bowel regimen. Do we need to up your fiber foods? Do we need to up particular types of foods to encourage going to the bathroom if you're having some constipation, or perhaps changing the other direction if you're having a little bit more loose stool? But we definitely know that the two are related.
Great. And then Sarah, how about you? You can take that second part about depression.
Yeah, I think that the question is, does a lack of estrogen lead to depression? And I think in the short term, everybody is different and you're not doomed to be depressed if you're in menopause naturally or surgically, or you've had your ovaries shut down or removed. That's not going to necessarily cause depression, but everything is interrelated. And so any one thing can affect any other thing. And we're pretty famous for having some mental health struggles when we're going through menopause, but then, old ladies are not known for being depressed. So there's probably a period of adjustment while your body gets used to its new normal. Depression's impact on the gut. So so the question was actually not about estrogen and depression.
Go either way.
That was good. So you're
more information though.
Yeah, that was good.
So everything is related. I know gut imbalance can definitely cause depression. Does it go the other way? We know that anxiety can cause potty problems for sure. We've all probably experienced that. And so, yeah, depression, also everything is connected to everything. And depression is like everything kind of slows down. And so if everything is slowing down in our physiology, then that will probably impact us on a gut level. But yeah.
Yeah. Well, I can't thank you both enough. What an incredible segment that we had. And we're running close to 50 minutes now, but we know how valuable it is, right? And thank you all for the questions that you gave. Continue to put them in our chat, because we will look for them on Facebook, and we will actually log them over on her library, where you can find this information and this recording today. Do either one of you have anything else to leave us with? You have great tips. I love them. I hope everybody's keeping notes, but the good thing is you can get back on and watch it again.
My final thought would be to just be patient with yourself, and remember to, you're playing the long game day by day, and just be patient with yourself. Yeah, Erin.
100, and I would say 100%. Be patient with yourself. Slow and steady. Ups and downs are normal. Things will happen, but consistency is key. And our team is here to help you. Sarah's here to help you kind of work through all of that, because there is such a close relationship. But yeah, I concur with everything Sarah said, for sure.
Oh, good. Good. Well, thank you. Well, I will take us off now. So here again, we want to thank our sponsors. They are incredible. They help us do this digital series that we have. Thank you to West Pharma, as well as Daiichi-Sankyo and Lilly and Merck. We are most grateful. Remember, we have an incredible March coming up. So Wednesday, March the 8th at 5 p.m., you're going to be able to witness some acupuncture live right from the office. Anybody who had any questions about acupuncture, you're curious about it, please log on. And then on March the 9th at 6 p.m. Eastern Time, we're going to be joined by Dr. Lexi Munch, and she's going to talk about sleep behavioral, problems that we come across, and how to get good quality sleep and to provide better tips. So please join us all in March. Thank you again for logging in, and everyone have a wonderful weekend. Thank you.
Thank you.
Thank you.